what are the things that helped you the most of the treatments that you and I have done together?
Yeah, I think, well, prednisone has always been the one thing that has safely worked for me. I
Yep.
think I was on and off for quite a bit of time, but there was a lot of fear around it because the doctors were saying, well, you can't be on it too long, right? And so I think the first area of relief was like when I came to you and you said, listen, we can try a low prednisone. You can stay on a little bit longer. You don't have to feel like your world is ending. We'll monitor this, right? And that gave me enough confidence to get off the mental state of depression a little bit
Yeah.
because I
Yeah.
knew that I could now do what I needed to do and work in life and be happy for at least a longer period of time than 3 days, right? Or whatever the prednisone, of course, was. So
You were
that was
using prednisone kind of very sparingly when things were at its
sporadically.
worst. You'd say, okay, I'll
Yeah.
do this for 2 days because I have a work meeting or event and I need to get things calmed down. And so
Yeah.
one of the first shifts we did was say, look, do we want to be on prednisone for the rest of our life? No. But at the doses that are going to work for you, Joe, it's worth the small bit of side effect to calm the immune system down. And so you did great with doses of 10 or 15 milligrams. And so I think we hung there for maybe 2 months or so.
Yeah.
And that worked for you, correct?
It worked for me. And then I felt confident enough to even start reducing this down to 5 and now to none, right? Which is
Yeah, yeah,
fantastic because,
yeah.
I don't want to be on prednisone. I don't want to really be on any medication. So, but you're absolutely correct. And I think just the natural, just to be able to sleep as well, right? We don't talk about that too often, but the fact that I'm not sleeping, we're talking about just every night trying to take baths, oatmeal baths, right? To try and ease the tension and just getting a little bit of sleep. I mean, mentally that really crushes you. You can't focus on life after that. And this was every day for
It's
18
not present.
months.
Yeah.
Right. So um,
So, that's so horrible. It's just awful.
yeah, it's rough. So I mean, I think that's kind of where, all right, we got the prednisone, but we're going to figure out a long-term cure here, right? We'll give you something to get you through your days and work and operational. We want Joe back. So you
Yep.
gave me that option. And then I think as we get into more of the conversation, we found out what the cause was, I believe, and really starting to kind of cure the actual problem to it.
Yeah.